Okay, so today I'm going to talk about amalgam versus composite fillings. My title is Pick Your Poison. Technically, both of these types of fillings have poison. My purpose is to inform most of you about the ingredients that are in these fillings and the advantages and disadvantages of each type. So, the first type is amalgam, and it's been used for more than 150 years, so it's really not that harmful. A lot of people have been talking about how amalgam is like mercury poisoning. Putting that stuff in your mouth is terrible. It's a bunch of lies. Amalgam is a mixture of metals. The mixture of metals is silver, tin, and copper, which comes in a powdered alloy form. Then it is mixed with liquid mercury, and that's where most of the people are getting confused about where they're getting this poison from. Yes, it has mercury, but it's not enough to cause toxic problems. It's a potentially hazardous thing, but it's not likely to happen. These amalgam fillings hold many advantages. They're made of metal, so obviously they're really strong, and they're better for the teeth in the back, where you bite and grind on your teeth more, chewing, things like that. They're longer lasting also. They last about 10 to 15 years. I've had fillings since I was, I don't know, 8 or 9, and I haven't had to have any of them replaced, so I think they're pretty great. They're very inexpensive in comparison to the composite fillings. Insurance companies generally cover those more than they do the composite fillings. And according to the FDA, amalgam fillings are safe for anyone over the age of 6. This includes pregnant and nursing women. They did discuss how it is transferable, but how it's not going to affect the baby, it's not going to affect the mom enough to harm the baby. It's just such a small amount unless you were to do all of your teeth with amalgam. And they always say to consult with your dentist before doing any kind of treatment like that, but it's just highly unlikely. So unless you're younger than 6, you're pretty fine to have amalgam fillings. There are some disadvantages with these kind of fillings. About 1% of the population is allergic to mercury, specifically the kind that's present in dental amalgam. So if you are that 1%, don't get amalgam fillings. A larger portion of the population is allergic to the types of metals that are in the amalgam fillings, like the silver, the copper, the tin, things like that. Generally, they know before they go in to have amalgam fillings, just when they're little, playing with metal jewelry, things like that. They usually figure it out. One other thing there's 2 other things actually that are potentially disadvantages. One is that you have to remove more of the tooth structure for amalgam fillings. This is because just the type of filling material that it is. It's a metal, it's harder to cram into your tooth, so you kind of have to remove a little bit more of your existing tooth. The remaining part of the tooth that's still left, sometimes it's tinted silver after having the fillings, especially if the fillings are old, like 10 years. A couple of my fillings, my teeth are starting to turn silver because of the fillings are so old. So next we have composite fillings. These fillings are made of plastic and glass. Most people don't know that. They think it's just some kind of magical goo that is great, makes your teeth look pretty kind of a thing. But yeah, you're pretty much putting plastic into your mouth. The acrylic resin is the part that's made of plastic. That's kind of what bonds it's the bulk part of it, and it's also what the chemicals that bond the plastic to the tooth. And then the resin is also reinforced with powdered glass, so not only are you putting plastic in your mouth, but you're putting glass in your mouth. So to me, it's kind of the same amount of poison, I guess. They do have advantages that amalgam cannot even go to touch. They're just completely different, and they use completely different things. Composite fillings are generally used for anterior teeth, and And this is just because most people don't want silver fillings in their front teeth. They want their front teeth to look pretty and tooth colored. A smaller amount of tooth is removed when you're prepping the tooth for composite fillings, just because the type of filling that it is. It's kind of a gooey substance, and then it's hardened with a curing light, so it's easier to fit into small spaces within the tooth without having to take away a large amount. The filling is chemically bonded to the tooth, like I said earlier, so this is kind of what makes it strong and helps to stay to the tooth. Without it, it's often that it will just kind of fall out of your mouth eventually from chewing and wearing and grinding. The filling is tooth colored, so obviously it's going to look nicer in your front teeth. It looks nice in the back teeth also. It's just not generally recommended because it's not as strong as the amalgam, and hardly anybody sees in the back of your mouth anyways. Some composite fillings release fluoride to help strengthen teeth, so that's also a plus. Generally with the smaller kids at the practice that I work at under Mark Heilman, we use a type of composite filling that releases fluoride. It's called Equia. This type of composite filling helps strengthen the tooth, and it also helps prevent further decay and further cavities in that area, granted that the child keeps brushing his teeth. And the disadvantages of composite fillings are that they are less durable than amalgam, obviously because they're plastic instead of metal. They generally have to be replaced more frequently. They are more expensive, especially when you're paying out of pocket, when insurance isn't helping to pay for any of it. The amount of time the patient has to sit in the chair is approximately 20 minutes longer because of all the chemical curing and things like that. The fillings will chip, and especially if they're located between teeth that bite together. And some fillings release toxic substances, one of them being formaldehyde, because it's plastic. So not only does amalgam release toxic substances, but so does composite fillings, and both of those are in a very small amount, so it's not going to kill you. In conclusion, both amalgam and composite fillings have their advantages and disadvantages. Both types of fillings are harmful substances. Not harmful substances, but have harmful substances in them. I hope that the audience will now look and think twice about which kind of filling they're putting in their mouth and understand all of the information behind it before they go jumping to conclusions. It's always recommended from my dental experience under Mark Heilman that the amalgam fillings are used in the back and the composite material is used in the front. However, we always tell the patients that it's up to the patient. It's definitely their choice, it's their mouth, their life kind of thing. Some of the sources I used were the U.S. Food and Drug Administration, WebMD, and of course a couple different dentists I have listed in my bibliography. So that concludes my speech regarding amalgam and composite fillings. I hope you have a great rest of the semester.